50 years. Former professor at Mahal Hospital and Medical College. Clinical practice at Just Slope Hospital, HL Reliance Foundation Hospital, Bhatia Hospital, Lotus Clinic, Mumbai. He was featured in Dr. Tanna, Story of a Legend, Trauma International, and he is recognized as a pioneer in orthopedic practice and education in India. Welcome, sir.
Okay, osteoporosis only for practicing doctors. I wouldn't say orthopod because it applies to everyone. Maro only to all the pundits theory. I'm not bothered about it. I'm going to talk about the day-to-day practice treatment of osteoporosis. Who should handle osteoporosis? I spoke to 2 endocrinologists friends. How many cases they see in osteoporosis? Not more than 5-7 in a month, or maybe more, and all sent by orthopods. Then how do you give talks? Orthopods think we are expert and they call us. We read and speak. You and me, orthopods, see most daily few cases directly or indirectly. 8-10 cases on an average. In a busy practice we must be seeing daily. So we should be knowing it better, and we should be treating them more efficiently than about 20% started treatment of porosis even in a fracture neck of femur at the age of 60-70. My guess is only 5% must be treating treatment for even polycystic fracture in elderly. Suggestion: almost all elderly neck, femur and distal areas need post-surgery treatment for osteoporosis to avoid second and a third fracture. When I said this in a meeting, one of the orthopods in purely fun commented, "Sir, that's the reason we do not treat them to get them again, the fracture, and back to us with a fresh fracture." Prevalence of osteoporosis fracture: 1 in 2 women over 70 will get an osteoporotic fracture. 1 in 5 over the age of 50 will get osteoporotic fracture. Who only females lose bones, why not men? It's a dilemma which I always had. World is always ruled by she god. So men have all the diseases. Men have very few diseases. And let me tell, physiologically women are stronger than men, I have no doubt about it, except in a physical strength. But now women cricketers hitting sixes, we all have seen. When he god came to locum power, when she god was delivering a child. He god couldn't undo anything what she god had done it, so she gave osteoporosis to the women. That is how the osteoporosis came prevalent only in the women. By the time he god does more damage, she god, not trusting the husband, came back and immediately after the childbirth has ruled the world all through. After that, they never had a second child, and that's why there is only one God. And the common bones affected, we all know: vertebrae, hip bones, wrist bones. Now, if this is not treated, chances of a second fracture in vertebrae is more than 40% in a year. Height reducing due to porosis and vertebral fractures, we all know about it very well. Let me tell you about osteoporosis. Into the cells, the bone cells, these are the ones which are forming bone. These are the bone cells themselves are missing in osteoporosis. Normal matrix is there, but the bone cells are missing. So the bone formation doesn't happen. While this is the typical situations where bone cells are missing, the matrix is there. So only by calcium and vitamin B, osteoporosis will not improve. This osteoporosis has bone only matrix, only calcium and vitamin D3 will not cure this. These are we all know the DEXA report. And unfortunately today, screening of the wrist and the heel as fashion it has become. in exhibitions and in meetings and everything. It is there, it is useless. I very emphatically mention about it. Screening is done with the belief that as the peripheral DEXA measurements gets higher, the chances of central DEXA measurements being low is less. Is not true. Mass screening test is not dependable. Do not fall into it. Suggestion: all neck, femurs and wrist fractures and vertebral fractures need treatment for osteoporosis. Do DEXA for confirming and start treatment aggressively. Leave all those jargons of how an endonate burns, rankles and osteoclasts and all those damn things. I'm not talking about it. Essentially, no one can become rich by saving money. One can only become rich by making money. What can be done first to reduce the ill effects in the future? Build boards at 100% before menopause, sets in both men and women. Weight bearing exercises is the only way to build boards. Walk, walk, walk. Swimming is not a good for osteoporosis. It's a good exercise otherwise, but it's not weight bearing, so it's not a good exercise. Osteoporosis exercise workout. That's the only way in which you can build up the bones before menopause or before aging. Before spine or hip fractures, it presents with vague pains all over at the back and thigh. This is the typical post-menopausal women get these all aches and pains. That's the time when you have to pick it up. I talk about the non-fracture female patient with vague pains above the age of 60 or below the age of 60. Roll out hypothyroid by TSH. Roll out vitamin D3 and B12 deficiency. Do a local study of phosphorus, calcium and magnesium. Even calcium, magnesium and phosphorus is supposed to reduce the osteoblast formation, so all three of them are important. And DEXA to see osteoporosis. I will also add PTH levels to see the parathyroid function, which will be raised in vitamin D3 deficiency. DEXA is also raised in osteomalacia. So first PTH blood investigation, if high, give calcium and vitamin D3, see PTH again, we need repeat DEXA. Only osteomalacia DEXA will improve dramatically with treatment, never in porosis. Porosis it only partially or marginally goes down or something, hardly ever it dramatically improves. Now after vitamin D and calcium, PTH is normal and DEXA is -2 or above, start calcium, elemental calcium, 1000 to 1200 a day, and vitamin D3 60,000 units a week orally. Now here the catch is Shalcal 500, I'm just doing the name. That 500 is not elemental calcium. If it is not elemental calcium, it is of no use at all. 1200 calcium carbonate is the only one which gives 500 calcium. So you have to see that there has to be elemental calcium 500 twice a day is the minimum dose. Majority of the people take once a day. And that is why the Femina and the female magazines start calcium as soon as you are 40, and they continue with one tablet a day. That is not enough. And if it is also not elemental 500, it is only 200 calcium they are taking, it is useless. So first is prevention, which is exercise. Taking calcium regularly alone doesn't cure osteoporosis. Taking calcium regularly alone does not cure osteoporosis. Calcium is needed along with vitamin B. Femina and many female magazines and all drug companies made fortunes selling calcium to females all over the world. Prevention and management of osteoporosis, conscientious statement from Scientific Advisory Board of the Osteoporosis Society of Canada. Calcium supplementation cannot substitute for the hormone therapy in prevention of the postmenopausal bone loss fractures. Adequate amount of vitamin D and HRT today, which has become confusing because some of those reports of cancer of the uterus and the breast has come up, but it has been considered to be a wrong report, and HRT is considered to be today the best treatment for first 10 years after menopause. Still, hardly many people use it. Observation, large majority of the population has vitamin D3 deficiency. Vitamin D is necessary for calcium absorption, and only calcium intake will not improve the bone. So this is all we have taken. Available calcium has to be 1500 to 1500, elemental calcium 1000 to 1500, then only it is effective. Importance of calcium, vitamin D for osteoporosis, we all know it. What are the drugs used to treat osteoporosis? Now HRT post-menopausal woman, I think, is one of the most important treatment which you should continue, which is not being done regularly. Current phosphorus and magnesium and bisphosphonates. To me, bisphosphonates do not exist. It is a past. It doesn't exist in newer drugs which have come up. I would not think I have been using bisphosphonates of late. Teriparatide, yes. Denusanab, yes. Rhombozoosome, yes. Most are having vitamin D3 and oral vitamin D3. Some doctors advise injectable with the false impression that it acts faster, which is not true. Oral vitamin D3, 6,000 units once a week for 8 weeks or 6 weeks to be repeated arbitrarily every year is the treatment which I would presume is the standard treatment. HRT immediately, I have already talked about it. Calcium is needed with vitamin D3, so this is the one which all of us have to understand that you got to give calcium and vitamin D3. Now calcium carbonate, we all know about it, is not enough unless it is 1250. I am repeating this again and again because majority of the people do not see this. 1000 milligram pill of a calcium carbonate which contains 400 milligram of calcium, less than half of your recommended dosage. So when you choose calcium tablet, 1250 milligram calcium carbonate is needed for a normal need. Now here, calcium deficient like rickets also happens in adults and osteoporosis. This is what is the typical difference between the two. What is the current practice in Dexine -2 and then start bisphosphonates? So in one of those recent meetings on osteoporosis, one of the leaders in osteoporosis said, please listen to this. Are we harming our patients by starting on alendronate, bisphosphonate first and then starting PTH? Bisphosphonate slows down the bone loss, which is normal in aging, that is like saving money. While PTH works by forming bone, that is making money. Listen something different. How will you help by protecting empty walls by bisphosphonate first? There is nothing in the wall. What are you going to do about it? First, fill up the walls.